Hello, my name is Nick Best. I'm an occupational therapist and part of my job is to advise people on the management of breathlessness. Today I'm going to be talking about deconditioning and the importance of exercise. It's important to remember that the advice I'm giving in these videos is for the management of chronic breathlessness, i.e. breathlessness that you've had for a long time that's not new breathlessness that's due to likely some underlying condition that you know about. If your breathlessness is new, or if it's changed suddenly, got much worse suddenly, and you're not sure why, then please seek medical advice. So, today I'm going to be talking about deconditioning and exercise, as I said, and it's a fairly simple message really, but it's one of the most clear findings from evidence on this subject, that maintaining levels of exercise is important in reducing breathlessness or stopping breathlessness from becoming worse. And the reason is fairly simple. Your heart is a muscle, and the muscles that power your lungs to get them to breathe are obviously muscles, and as is the case with other muscles, it's a case of use it or lose it. So the problem a lot of people have is that when they start to get breathless for various reasons, their amount of exercise that they do goes right down, and then whatever the underlying problem is that's causing breathlessness is exacerbated by the deconditioning of those muscles. Those muscles become less strong and less efficient because they're not being used so much. So we've established that exercise is important. So I'm just going to quickly go over the two most common reasons why people stop exercising. The first one is that people believe that breathlessness is harmful in some way, and that if they become breathless, that's damaging their bodies, and so they need to avoid doing it. They almost treat it like you might treat pain. Pain is or can be a signal from part of your body that what you're doing is damaging, and so you need to stop. And people think of breathlessness in that way sometimes, and so they stop doing the thing that brings on the breathlessness. So I'm here to tell you that that is in general not the case. Obviously, if you've had medical advice to avoid exercise or avoid certain kinds of exercise, then please adhere to that advice. But if you haven't had advice to that effect, then please continue, because it's very beneficial. So please be assured that you're not damaging yourself when you become breathless. Obviously, being breathless is an extremely unpleasant sensation, which is the second reason why people tend to stop doing exercise of any sort. Because it brings on a very unpleasant sensation, and we don't like unpleasant sensations. So that's entirely understandable. I'd encourage you to take things to the limit of what is comfortable for you. So I don't want you to overdo it, completely exhaust yourself, leave yourself absolutely gasping for breath all the time. But if you can tolerate a moderate breathlessness, if it feels okay to you, then please continue doing it. It's okay to be breathless as long as it's not too uncomfortable for you. And some of the strategies in the other videos might help you to tolerate a bit of breathlessness. And like I say, the more you can exercise and still be comfortable and find it tolerable, the better. Now, when we talk about exercise, most people think of going to the gym or going for a long run or something. For most people with a chronic breathlessness problem, these goals aren't realistic. And so exercise with chronic breathlessness can mean something very different. I'd encourage you to think about any physical activity as exercise, and for some people that's as little as walking to the toilet instead of using a urine bottle or a commode. For some people that's all they can manage, and if that's something you can manage and give you a little bit of exercise, then that's fantastic. For other people, exercise might be a lot more. So I'd encourage you to think about what you're capable of and grade it and do what you can do. And if you're one of my patients, obviously we'll talk through that and perhaps give you a program of exercise that is realistic for you. But any sort of aerobic exercise, walking of any sort, is better than nothing. In the current climate at the time when I'm making this video in March 2020, we've all been told to stay in our houses as much as possible. And for many people with a chronic breathlessness problem are in the category where you're told not even go out for the daily exercise that the rest of us are allowed to do, which makes this piece of advice very difficult. Normally I'm all for telling people to do as much as they can to get out of the house and exercise if it's safe and tolerable for them, but at the moment obviously it's not safe, and that's why we need to go with the government guidelines at the moment. So that makes it more difficult for you. Please be creative. Hopefully a lot of you have got gardens that you can exercise in. If not, like I said, walking around the house perhaps as much as you feel able to do is a good thing to do. So to summarize, in breathlessness, exercise is a good thing unless you've been advised not to. It shouldn't be harmful, and whilst I don't want you to make yourselves uncomfortable or make it too difficult, make things too exhausting for you, if you can tolerate a certain amount of breathlessness whilst you're exercising, that's okay and that's good, and it should improve the problem. You might need to be creative with how you do your exercise at the moment, but please bear in mind that this is one of the clearest findings of research on the subject. So if you can exercise, if you do find it tolerable, then please do so. Thank you very much.